My brother had called my husband and said that Mom had fallen, and that was on a Sunday, and we had to wait for MRIs and things to happen. Well, they said, well, we need her in the hospital on Wednesday, and that was really hard. My mom's 88. I've never really seen her sick. She's healthy, she's independent living, and to get to the hospital and see her in such pain, I mean, it breaks your heart.
She's very capable, but she's, a little bit unstable, and she had fallen, and she had a fracture of one of her thoracic vertebrae that needed to be fixed.
She was in such pain, and the care was so great. I thank God that she doesn't remember the pain. She doesn't remember how bad it was. It was just really difficult.
They had a non-stress test that day, and it didn't look too good, like there was something possibly going on.
I looked at my phone and I saw a missed call, and then I saw the text, and the text was, "It's happening tonight." And I started telling the guy that I commute with, I was like, "Hey, it's go time, we gotta go."
Tiffany needed to be induced. She has a clotting problem called factor V Leiden deficiency, so she has this, she required anticoagulation throughout most of her pregnancy just to make sure everything was going to be fine. And they reached a point where they thought it was best for her to be delivered just a little bit early.
I'm sitting in Mom's hospital room, which was right down around the corner from the birthing center, and Tiffany calls me and just said, I'm being admitted to the hospital tonight. They want to induce.
So we got to the hospital like about 7, got there, got checked in. They got us right up to the room, and so Dr. Andy came in, he broke my water. Literally, probably 5 minutes later, I started feeling really hard contractions.
It was so, how do I say it, bittersweet. My mom's very sick, and my new granddaughter's about to enter the world. But what was so great, they were just a corner away from, I was like 3 seconds from one to the other. And just to be able to be there with both of them was just incredible.
I knew that my grandma was in there, I just didn't know where. She wasn't that far away either. So luckily I was able to go and visit her, which was nice. It was nice to know that she was just right there. It was easy on her family.
If we didn't have the care that we had here, my mom could have been in Spokane, or Tiffany could have been in Spokane, but with the care that we have, we were able to be seconds away from both of them. And our hospital is so centrally located. I could go before work in the morning, I could go at lunchtime. Just to be able to see both of them at the same time was just incredible, and it was just like God's work or hand in 88 newborn is just miraculous, and that all the care that we needed was right at the hospital.
The concept of a community hospital is really a big deal to me. I don't want this hospital owned by somebody else.
The hospital always was just iconic in our community and giving back to our community. Just family community hospital. It was just great.
I really think the support for the newborn unit was really a big deal for us.
Now with the neonatal here, I think that's got to be my big thing, because Tiffany's high risk.
And it's been since then that we've had neonatologists join our staff, which is really important. And we don't have to ship sick babies to Spokane routinely.
It opens your eyes to how lucky we are to have the type of hospital we do here.
And it's already great right now, so it can only get that much better as they keep expanding and adding more features to help people's needs.
We have everything in our own backyard.